Please hold on. Please hold on. Please hold on. Please hold on. So today we're going to be looking at websites about many kind of bullshit practice. My name is Dr.Aliu today. And then the continuation of our video to so the goal of the training element is to put every participant the goal of the training. No, 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 no. Okay. So goal of the training. Yeah. So I believe you can hear me loud and clear now. Okay, thank you. So the goal of the training is to equip every participant with the skill, knowledge, and quality assurance and quality control for medical laboratory practice in ensuring that the laboratory deliver quality results that is timely, reliable, and accurate for patient healthcare. So these are the objectives. So we look at quality control in chemistry and endocrinology and quality control in hematology. Now, when we look at quality control, first and foremost, one thing we're going to look at first is quality control materials. Now, what is quality control material? Quality control material are substance that contains an established amount of a substance being tested, like the analytes now the test. So control that tested at the same time in the same way as a patient was sample. Does that make sense? So the same way you test the patient sample is the same way you should test what the control. The control should not be done by a specialized person or one person while somebody else is doing the patient sample. Now, what are calibrators? Calibrators are solutions with a defined concentration that are used to set or calibrate an instrument or system before testing is begun. Calibrator is also known as standard. Now, let's take, for example, you want to, uh, maybe you are 5 meter tall. Then they set something on a height of 10 meters. For you to be able to see that, you have to adjust your height to 10 meters. That is the only way you can see that, two of us. So calibrators help to adjust the set point of an equipment for it to read at a particular what, or for a test method for it to read at a particular level or a particular frequency. Am I communicating? Yeah. So division of quality control. Now, quality control are found in quantitative examination, qualitative examination, and semi-quantitative examination. So what is quantitative examination? Any test that have a definite value, let's say 20 millimole per liter, is a quantitative test. Qualitative test shows absence or presence, positive or negative, etc. Those are what qualitative testing. Now, we have what we call semi-quantitative results or semi-quantitative testing. These are tests like maybe malaria, you say 1 plus, 2 plus. They have a level of quantification. Let's say 0 to 5, hyperflu. Those are what semi-quantitative tests. So when people come for testing or when we do testing, these are the three possible examination. It could either be a qualitative testing, a quantitative testing, or a semi-quantitative testing. Please, if you can hear me, type on the comment section that you can hear me loud and clear. Okay, thank you. Okay, thank you. Now, what are the type of QC materials? Now, QC materials can be frozen or acid or non-acid. Frozen, lyophilized, or chemically preserved. Now, acid or unacid. So acid is they have already measured the concentration of that test. That is acid. Unacid, you have to determine the concentration. So you have to run multiple tests to ascertain the mean and all those things. So that's unacid QC. Acid means that's already been estimated. The QC material has already been estimated. So we have frozen, lyophilized, or chemically preserved. We have acid or unacid QC. What is the characteristics of a good quality control material? Now, the substance being measured in the test must be present in the control in a measurable form. So that substance, that test that is being measured, it must be contained. So let's say, for example, now, if you are having a test, let's say in chemistry lab now, you're having a test of sodium, potassium, a QC. That QC material must have potassium substance that can be measured. If you don't have, it's not a good quality control. So the amount of the analytes present in the control should be close to the clinical decision point of the test. Now, control should have the same metrics as the patient sample. So if it's urine, it should be in a urine-like form. If it's serum, it should be in a serum-like form. It should have the same metrics of samples. Am I communicating? If it's a whole blood, then it should be like a whole blood kind of QC. Now, establishing ranges in QC. Now, assaying control over time. When you want to establish the range in QC, especially in quantitative testing, you have to run a minimum of 20 samples.
at least for 10 days. Now, you find the mean, the median, the mode. This is for quantitative testing, please. Take note. Now, before calculating your QC range, any data that looks out of the range, any data that looks like an outlier. Let's say, for example, you're having a measurement of 20, 30, 21, 22, 23. Suddenly, you now have one value that is 80 or 35. That data is what? An outlier. So if one or two data points appears to be too high or too low for the set of data, they should not be included when calculating the QC range. They are called what? Outliers. Now, if there are more than two outliers in the 20 data points, there is a problem with that data and it should not be used. If you have more than two outliers in a 20 data, then that data should not be used. There is problem or challenge with that data. Okay. Identify and resolve the problem and repeat the data collection. Now, you have seen it for this what we call normal distribution curve. A normal distribution curve, if many measurements are taken and the results are plotted in a graph, the value forms a bell-shaped curve. So this is called a normal distribution curve, or what we call now Good-Sound distribution curve. So like you can see on this curve, now the U is the mean. We have the plus one standard deviation minus one standard deviation, plus two standard deviation minus two standard deviation, plus three standard deviation, and minus three standard deviation. We're saying that statistically, 68.2% falls within plus or minus one SD, while plus or minus two SD, about 95.4% of the data should fall under what? Plus or minus two SD. While plus or minus three SD, the range 99.7% of the data should fall under what? Plus or minus three standard deviation. Now, this is what we call leveraging graph. Remember, we're talking about quality control in quantitative testing. Now, if your test is being done, there's what we call the mean value and the standard deviation. We're going to look at that so shortly. So you have, these are the days from 1 to 18, as you are seeing, is the numbers of days gone. Why the point, those black points, those are the points, the plotted graph of the QC that is being done. So let's talk about accuracy and precision. What is accuracy? So both accuracy and reliability helps us, accuracy and precision helps us to judge the reliability of a test method. So accuracy is the closeness of a measurement to its true value. Precision is the amount of variation in the measurement. So accuracy. So how close is that value you are getting to the real value? That is accuracy. Precision is the ability for variation in the measurement. Let's say, for example, you do a test now, you get the same value, you get the same value, you get the same. You said that equipment or method is said to be precise. Why? Because it has a close repeated what? Values. Am I communicating? So a test can be accurate and not precise. But we are looking for what? Good uh, results shows accuracy and precision. You can see accuracy is hitting the target point and it's precise. It's on one, it's hitting similar spots, it's targeting similar values. That's accuracy and precise. This one is precise. It's not close to the target, which is the center. But yet it's giving a repeated value constantly. So act precise but biased. This one is precision. Not accurate, it's not precise. So that's the difference between accuracy and precision. Is that well understood? If it's well understood, please type on the comment section. This is well understood. Okay, thank you. So let's look at establishing of quality control materials. Not actually need all these formulas, but let me just go through them. So this is mean standard deviation formula, summation of x minus x bar all square divided by n minus 1. So formula for coefficient of variation is standard deviation over mean times 100%. So coefficient of variation, CV, is used to monitor precision. When the laboratory changes from one method of analysis to another, the CV is one of the elements that can be used to compare the precision of the method. Ideally, the value of the CV should be less than 5, except otherwise stated for that particular test. When we talk about detecting error, error that can occur in the test process may be either random or systemic. So when you say an error is systematic, what does it mean? When you say an error is random, now let me explain it in this way. Now, if you come to work late, let's say due to rain, one thing, and you don't need to come to work late, that occurrence once is known as a random error. But when you come to work late on Monday, come again on Tuesday, come again on Wednesday, come again next week, it's no longer a random error. Let's take the lateness as error. It's now what? A systematic error. Are we communicating? Yeah. Okay. Thank you. So when detecting error, you first to know what we know as bias, imposition, trend, and shift. Bias, imposition, trend, and shift. So when the control value falls within 2SD, now it is fine. When it falls outside two standard deviation in the epidemic chart, it calls for concern. And I was going to explain this. You can see this is Lefigeni's chart. Lefigeni's chart is a graph that quality control data is plotted to give a visual indication whether the laboratory test is working well. The distance from the mean is measured in standard deviation. You can see the mean here. From one mean to another is one standard deviation. And from that standard deviation to another one is another standard deviation. So 2 lines above is plus 2 standard deviation. 2 lines below is what? Minus 2 standard deviation. So those are where the values should be within. Okay, look at this. When plotting a lipogenic chart, you select the appropriate control materials. You analyze those materials and assessing method of the performance by collecting minimum of 20 measurements over 10 days, minimum of 10 days. Then calculate the mean and standard deviation of the data. You can do that through analysis, you can do the manual, they can do it even with an Excel sheet. Select the numbers of control measures to be used per run and select the controls to be applied. So I want to show you what is called the West gathering. Remember that we're talking about quantitative testing now. So this spells out qualitative and semi-quantitative testing. Now, wedge guard rules are multi-rules, multi-QC rules, that's their name, to help analyze whether or not an analytic run is in control or out of control. It uses a combination of decision criteria, usually 5 different control rules, to judge the acceptability of the analytical run. Wedge guard rules are generally used with 2 or 4 control measures. So we'll get to understand the statement. So let's explain the individual rules. Let's look at the individual rules. The individual rule. Please read it within yourself. Just I give you 1 minute or 2 minutes to read it within yourself. 1 2s, 1 3s, 2 2x. Please read them, and I will explain shortly. Okay. Now let me explain. For the 1-2S rule, we say that when one control measurement exceeds two standard deviation of the control limit, either above or below the mean, that is 1-2S rule. So one of the control you did is more than two standard deviation. It has violated what we call the 1-2S rule. Now, this rule is a warning rule to trigger careful inspection of the control data. It's a random error. Now, 1-3S, this rule is commonly used when Lefferts chart. When the control limit set of the mean is three standard deviation of the control. Now, when you use three standard deviation as your limit, not two standard deviation, a run is rejected when a single run measurement exceeds the mean of plus or minus what? Three standard deviation. Now, next is 2-2S rule. This one is like saying two runs rejected when two consecutive control measurements. That's two standard deviation is greater than two standard deviation of control limit at the same side of the mean. Now look at this. I will show you the graphical representation. R4S rule, this rule rejects a run if two control measurements, there are two control results in a group, exceed the mean within a four standard deviation difference between two controls. I will show you that in the graph. Now, this rule, which is 41S now, this rule rejects a run when four consecutive control measurements exceed one standard deviation on the same side of the mean. Now, 10S rule. This rule rejects a control when there are 10 consecutive control runs. When there are 10 consecutive control runs on the same side of the mean. Now, let me show you the graphic representation that you be able to understand. Example of the wedge guard, we'll look at it. This is 2-2S rule. So you see, the two consecutive runs are greater than two standard deviation. So that is 2-2S rule violation. See the next one, we have 1-3S rule. So one run, that which is showing the red point, is greater than what? Three standard deviation. In this, you reject what? The control. You can't release the patient result on this. Now, the one we call the 1-2S rule. 1-2S is that one of the runs, one of the control data is greater than two standard deviation. So if you have where you use 2 as a limit of your standard deviation, then 1-2S rule, you don't have to accept the result. So these are very, very important for the things we do and the quality of results for this. For 1S rule, you see it, for consecutive runs, you see it circle red, is on one side of the mean and is greater than one standard deviation. That is what 4-1S rule. 4 runs. 4. 1, 2, 3, 4. Then 1S is the standard deviation is greater than what? One standard deviation. I hope I'm communicating loud and clear. So how to perform multi-QC rules, collect your control measurement in the same way you would have done for a regular Lefferts control. Then you establish the mean, standard deviation, and plot your graphs. Do you understand me? And then you can do it automatically. There's some equipment that does it automatically. You don't need to even be doing manual. The only difference is the interpretation of the result. While we use a multi-route procedure, tests for false rejection can be kept low while at the same time maintaining a high error detection. This is done by selecting the individual rules that is applied. Test for false rejection to build up the errors by using the rules together. It will reduce the error. A multi-QC rule procedure uses two or more statistical control rules to evaluate the QC data. So you must do minimum of what and then reject a run if any of these statistical tests is positive. In other words, you can't use one level of QC to be able to do multi QC rules, you have to have minimum of what, two QC, either normal, abnormal, or normal and low, normal and abnormally high. At least two levels of QC. So the multi QC procedure usually two or more statistical tests control rules to evaluate the QC data and then reject a run if any of these statistical tests is positive. So other common multi-rules used for analyzing three different controls. When you have three different controls, like you call level one, level two, level three, high, normal, and low. You can use any of all these rules. You have the 3-1-S rule. For this rule, reject when three consecutive control measurements exceed the same plus or minus one control limit. So the three different controls, both high, normal, and low, all of them at that day of measurement, they exceed plus or minus one standard deviation. You have to reject. Next, 2 of 3S2 rule. For this rule, reject a control if two out of the three control measurement. Now, if two out of the three control exceed the same plus or minus two uh, control limits. So out of that three controls you did, that three levels of control, if two of them out of the three has a limit above plus or minus two, you will need to reject. Then 6S, for this rule, reject when six consecutive control measurement of one falls on the one side of the mean. See, six guns, they are always on one side of the mean, whether positive or negative. You need to reject and you must not release patient result. You see, a lot of us, when we do tests, once the test is within, test value is within an analytical range, on reference, we think that it has passed. But you see that it has not passed, you have to analyze statistically for we to be able to know that this is appropriately done as it should be. So when troubleshooting QC, what do you do? First you check the equipment. It could be a maintenance issue, daily, weekly, periodic maintenance, daily quality control, calibration, SOPs, temperature check, equipment error, the personnel train, all these things you need to know. This could cause QC failures. This could cause QC what? Failures. So if the maintenance is not properly done in an equipment, whether weekly, daily, monthly, can affect the quality control. Then um if the maintenance is not done, as I said earlier, can affect what? The QC. Then daily quality control. So the daily quality control on the equipment should be done. Calibration should be done as I went to. There should be an SOP, should be a temperature check, equipment error log, personnel training, and etc. When looking at reagents, you need to look at, we are troubleshooting QC now, fail QC. Look at cold chain. Was the cold chain broken? Was the reagent come in the right temperature? You must look at all these things. The reconstitution, was it properly reconstituted according to the manufacturer instruction? Packaging SAT, API, onboard stability and expiration date. You have to check out if there is the reagent onboard has expired. That means the one you put in the equipment, if it has passed the onboard stability, it can result to QC failure. Reagent log, lot to lot verification, lot to lot variation. This can affect what? The QC performance for that particular test. So next, you need to also check the control itself, the control materials. The traditional control, blind QC, stability, what is stability of the control? Did it tolerated or the control constituted properly? Was there proper documentation of a lot of things you need to put into consideration before you decide on what have actually happened to why the QC failed. Just like you taking a car to the mechanic, they need to look, oh, what's wrong with the car and the rest. So this is you look at the equipment, you look at the reagents, you also look at what the control. Sometimes too, you need to look at the environment. Because if there are some equipment, if the equipment are not stored in the right temperature, if the equipment does not operate on the right temperature, it may be malfunction and the QC may not pass. Are we communicating? Yes, hold on. So next we look at overview of QC in microbiology lab. Now, this is very, very important for us to be able to what we need to do. So I will stop in QC microbiology lab for today. So policy control in MCB microbiology look like other requires a deliberate action to maintain quality and quality control. One must avoid contamination as the level of contamination is higher here in microbiology lab. Quality control involve both pooled samples and commercially prepared QC. Yeah. External quality control is critical here and also in other places. So quality control in microbiology requires use of live control organism with predictable reaction to verify that the stain, the reagent, and the media are working well correctly. So they must be kept on hand and carefully maintained in the form of stock. We have a call stock culture and working culture. For each reaction, organism with both positive and negative results should be tested. So the following organization offers reference strain for microbiology. We have ATCC, NTCC, CIP, American Type Culture Collection, the National Type Collection, NTC, TCC, and CIP. You can purchase reference strains from these people. Yeah. So let's look at quality control of stains. Stain, you will use stain majorly in microbiology and also in histology. So, in performing many qualitative and semi-quantitative procedures, stains are needed for evaluating microscopic morphology of cell, parasite or microbe, or to determine the presence and absence of, of an organism or of something that is of interest. Now, in microbiology, permanent stains such as iodine, orange, trichrome, and iron hematosine for fecal parasite and giemsa stain for malaria are frequently what used. So we have ground staining, acid fast stain, keroid staining, preparation, and etc. All these are many stains. Because of their importance for these stains we are talking about, they should be checked daily with positive and negative what QC materials to make sure that the reagents are active. Because if the reagent is not active, if the stains are not quality controlled, you're going to give us false results. So stains should be also examined to look for the precipitation or crystal formation and to check for bacterial contamination. Carefully maintenance and care of the stock. We know what we call stock solution. That solution you take out of it to prepare a working solution. It's known as what? Stock solution. So carefully maintenance and be careful of the stock and working solution of things is an essential component in a system to provide good quality in microscopic examination. So this is different between a good stain and a poor stain. You can see the way it looks in the microscope. This is a good stain, a poor stain, showing the different quality of ground staining. So let's look at quality control in microbiology media. So QC is essential for the media. So the media has to be quality controlled. You notice that the media where you grow this but where you go this organism. So you have to verify performance like sterility test, appearance, use of control organism for verification. These are various control organisms you can use for verification. So you can use staph aureus for blood agar, mantle salt, and some antimicrobial sensitivity testing. You can use Neisseria gonorrhea, ATCC for chocolate agar, and Thaya Martin agar. You can use the Escherichia coli for McConkey or you see McLean Bloom and some antimicrobial sensitivity testing. Internal media preparation records. So you have to have record for all the media you prepared and all the quality control checks. So internal media preparation record, you have to put the data and the name of the person who prepared it, name of the medium, and lot number and the manufacturer, number of prepared plates, how many plates you prepared, the tubes, the bottles, all flags, assigned lot batch number, color, consistency, and appearance, numbers of plates used for QC, sterility test results for 24 and 48 hours, growth test, pH, all these tests and record has to be there. So in our next class, we'll look at overview of the standard quality assessment schemes, the quality assurance and quality control. Please hold on so that I can take a question shortly.